good old days, there were joint families and they were living together, and caregiving was distributed among multiple people so that they're not stressed out and they're able to talk to other people, etc. With changing social dynamics, kids moving away, and aging population, how do you see caregiving shaping up in years to come?
Yeah, it's a really thank you so much for that question. I want to say that the caregiving was distributed among women. It was not distributed amongst family members. So I think it's really important for us to recognize that caregiving remains a very gendered, uh, it's very gendered, and there's still predominantly women are providing care. And we've seen that during the pandemic as well, that women are leaving the workforce and to take care of young children and take care of people at home. Having said that, of course, as one of my colleagues says, the remainder of care is provided by men, so it's an everybody issue. I think this is where a lot of the policies will come into play. I agree that when there's more of a community setup, people are available to provide care and distribute the workload, especially around practical tasks. But I think we need more policies that support the alternate arrangement where you may have families living far apart and we need people to be involved in the care. So for example, if you're a long distance caregiver, which a lot of us are for our loved ones in other parts of the country or the world, can we participate in the clinic appointments virtually so that we can hear firsthand what is required for us? The other thing is we're going to rely more on social structures rather than social systems. The infrastructure, for example, people like home health care services could be an example, or nursing care, or respite care, long-term care. So I think being able to rely more on other infrastructure is important. But I think we also just need better policies to support directly the needs of the caregivers. We need to normalize the experience of caregivers. We need to provide strategies in which the healthcare system screens caregivers for their stress, their depression, their anxiety, their own concerns. There's a statistic from a survey that was done now in 2015 among cancer caregivers, and only 16% of cancer caregivers had been asked by anybody in the healthcare system how they were doing, and fewer were provided resources. Whereas the caregiver stress for cancer caregivers is quite high. So we need to normalize addressing the needs of caregivers.